So just how can families protect their children in these extraordinary times? I'm joined by Dr. Shaheda Omar, Clinic Director at the Teddy Bear Clinic, which focuses, of course, on abused children. Dr. Omar, very good afternoon to you. Always good to see you. So I would like us to begin firstly with what protections are in place in terms of law when children are sent into these isolation centres for COVID-19.
So I think if we just firstly unpack, I think this is actually a travesty of justice, what we've seen happen here with the 2-year-old. Firstly, on what grounds was the 2-year-old in isolation? If we're looking at the Children's Act, you know, the best interest of the child is paramount. And it seems that this health crisis has eroded children's rights. We know that it has subjected this 2-year-old to further traumatization by isolating the child, taking the child away from the primary caregivers and placing the child in an area or in a facility which is absolutely alien, foreign, and very scary and daunting for a child. So I think if we just look at the systems, we certainly failed this child in ensuring the protection of this child. Yes, and if we look at the vector of transmission, it's not child on adult, it's adult on child. So once again, we have not looked at the best interest of the child here, which is imperative. And I think that's the rule of thumb. When we look at placing children in any facility, it should be for the best interest of their child.
And Dr. Omar, without going into the circumstances of the family and why they had to leave their child ultimately to be isolating at the hospital, I want to speak to what you've just mentioned about children and their safety. So the hospital CEO says that this particular ward, only breastfeeding mothers are allowed to be with their children. Our reporter Slindelo Masigane was saying that there is a guard at the entrance in the evening. What do you say to the idea of leaving a 2-year-old child in a ward without a guardian or a close relative who's able to be there with them, given that, of course, we are dealing with this extraordinary circumstance of COVID-19, which is thought to be rather infectious, and we're limiting interaction between people?
So leaving a child without a guardian, we know, is very traumatic. We know that the separation anxiety can certainly subject the child to enormous stress and trauma and induce a lot of anxiety. However, under the circumstances, we are not clear under what circumstances this child was separated, but one needs to ensure that there would be a secondary caregiver available. So in this case, one would expect a medical professional, whether it's a nurse aide or a nurse or any other health practitioner, who should have been available and who should have been there to ensure the safety of the child. Because the child is in an isolated facility, surely it means that the circumstances are rather serious. And a child of that tender age cannot speak out or reach out for any kind of support or even to be rescued. So it calls for more stringent and attention. And by having a guard only in the evening is totally unacceptable. It's shocking that not having any kind of security or stringent security measures to prevent all and sundry from having access into the facility. Because once again, it's failing the child and failing the best interest of the child. Because we are looking at the fact that they cannot locate a suspect. First of all, nobody should have been allowed into the facility, into the hospital, if adequate and appropriate security measures are put in place.
And let me ask you about that, Dr. Omar, the safety of children in general at healthcare facilities. Is the abuse of children in hospitals, clinics, a common thing in South Africa?
Well, I cannot speak to the fact that it's a pattern or a trend. But it is something that has happened, not for the first time. We've had several incidences where children have been violated, have been sexually abused in hospital settings. So this is not a unique case, but it's not an acceptable explanation or response to the protection of children.
Final question then. We're dealing with a 2-year-old here who's been violated in one of the worst possible ways. if a suspect is indeed identified at some point and goes on trial, you do have the situation where, as a 2-year-old, she is most likely not going to be able to articulate what happened on the day of the attack. So legally then, how do we go about getting a prosecution?
What you've described is actually very bleak and grim and not in the favor of this child. And that is why we say that the protective measures that were supposed to have been implemented has not happened, and to actually get somebody prosecuted and convicted is going to be a huge challenge. So once again, all I can say is that law enforcement and the healthcare facilities have failed a child and have failed children and have failed the community and the broader society, because we know that a 2-year-old cannot speak out. Even older children in a situation of trauma may not be able to stand up, speak out, and break the silence or even identify the perpetrator, because there isn't corroborating evidence and there aren't collateral sources of information. Unless we can produce that or create that kind of opportunity, the chances are absolutely grim and not in the favor of this child and other children.
Dr. Shaheda Omar, thank you so much for speaking to us.